Hello, I'm Matthew Weinstock with Hospitals and Health Networks. So how well are your board meetings structured? Are you addressing some of the key issues of health reform? Luanne Stout, Vice President and Chief Governance Officer at Texas Health Resources, says that there may be a new way for running board meetings more efficiently and effectively. Luanne joins me now. Luanne, thanks for being with me today.
Good morning. Thank you for having me.
So let's start first looking at how board meetings are currently structured. And I know that's a gross generalization, but are you seeing that they're addressing they're set up to address the needs of health reform and transformation?
Unfortunately, what I'm seeing a lot of is that most people are running board meetings the way they always have, and that is planning agendas quickly and the easy way, which is largely focusing on performance updates. How are we doing on different aspects, financial, quality, et cetera, which are important. Those are important. But to the detriment of the quality discussion time that boards really need in order to understand the complex issues facing us today in healthcare.
So you say detriment to some of those issues. How so?
They don't have time. And then you tell them you need to have more discussion time, or what are you doing about discussion time? And the most common answer you will get is we simply don't have time, and our board members don't want to have longer meetings. And my proposition is that you don't need longer meetings, you just need different meetings.
I know one of the other things you talk about is leading with stories as opposed to data. We hear so much about let's show the data to get us to the next point on our board metrics. What do you mean about leading with stories as opposed to data?
You know, if someone presents information to you in a style that says, okay, here's what it is. I'm going to read to you lines 1 through 35, whatever, and this is the story of my financial report, for example. But then, what if they didn't do that? What if they turned that into a story instead and told you what you needed to take away from that data? So, for example, you'll notice that our bottom line is X, and you'll notice that our operating income, however, suffered. Here are the reasons for that. We've had a new competitor open down the street. We've got nationwide issues with volume because we think that it's because of increased deductibles, et cetera, et cetera. Here's what we're doing about that. And we've got some action plans in place, and here's what we're addressing. And of course, we're monitoring and so forth. So you're telling a story about what people should take away from all that data. Of course, you provide the data for those analytical types that like to look at it, but you don't talk through it.
So you're bringing some anecdotes along with it to right. Put some human faces behind the data.
You're making it easy for people to take away what it is they really need to know, and also giving them jump-off points for discussion. Sure.
Can you talk a little bit about how you've done some of this at THR?
Sure. We introduced, it's been a series of years that we evolved into this point. First, we provided what we called strategic discussion topics on the agenda, and we provided a block of time for that, and then we had all the usual stuff. And so at least we were going to have one topic that had in-depth discussion. After that, as we progressed and got a little more practice at doing that, what we did was we introduced board presentation guidelines, so that the meeting didn't get hijacked by those presentations. And we asked all speakers to follow those. We cut the agenda, changed the agenda, put the discussion topics first, used the consent agenda more effectively to create more time, and then put all those performance updates at the end and limited their time.
And how has that gone? Did board members react positively to that?
Board members reacted very positively to it. And then I went around personally and talked to each of our boards and explained to them what we were trying to do and what their role in it is. And so you have a responsibility to talk. We selected you based on your competencies and your expertise. If you're not sharing those with us, we're not benefiting from you as a board member. And so they took that seriously, and they try to do it.
What about your executive teams that are in those meetings?
Tougher, because they've been giving presentations for a long time. They think they know the best way to do it. Getting them to think about a new normal is sometimes challenging. However, when you limit their time to, say, 5 minutes for a performance update, they're going to have to boil the ocean, and they realize that. Even if they didn't want to, they're going to.
So, Luanne, tell me a little bit about this notion of the 20-20-60 rule. What is that?
Okay, the 20-20-60 rule I made up based on research, of course, but basically it boils down to this. You spend 20% of your time telling the board what the issue is, the 20% of your time telling the board how it got that way, and then the majority of your time, 60%, telling them what you're going to do about it. So what I see mostly is that a lot of boards are doing 100-5-0 or 100-0-0 or 95-5-0, and that leaves board members asking, okay, I see what the issue is. What are we doing? What can we do? And it leaves them frustrated. We usually have action plans. We usually know what we're going to try and do about it. We should be telling them that, and we don't always do that.
So let's pull this back a little bit and go to that 30,000 foot level. So how does restructuring how board meetings run using the 20-20-60 rule or instituting fund, things like that, how does that propel a hospital or health system towards transformation?
Because if you are talking about the issues involved in transformation, most organizations are thinking and planning about population health and the environment around us, healthcare reform, the ACA, all of those topics. But if you're not spending time educating and talking and understanding with board members those things, how are they going to be helping you with planning and meeting the needs for the future for your organization and advancing your organization along that transformation? Most organizations are talking about the continuum of care. How are you engaging your board in those discussions? If you suddenly spring it on them, they're not going to be as well equipped.
Well, great. I appreciate you taking some time to talk today.
Thank you.
And I'm Matthew Weinstock with Hospitals and Health Networks. Thanks for tuning in.